This is going to be a commentary video, and one that has a bit of an urgency. Uh, First of all, I have to say that I believe when people put out video demonstrations, that is always a great thing, because only when we show what we do and when you show what you do, there is an actual way to interact about that. So kudos to that. And that is probably the only really positive thing I'm going to say about this demonstration. I have watched into it for a bit, and then I stopped watching it simply because I thought I'm not going to watch this more than once. So I will now go through it with you, at least through this scenario, and provide my commentary. Before we start, a disclaimer: I'm an educator about emotional well being. I'm not a mental health practitioner or a licensed therapist or psychologist. Everything I say is for informative purposes and my own personal opinion. So, mind you that the setting here is an intake session, which means it's basically the first conversation, the first real in depth contact that the therapist here has with the client or patient. So it's really the very first encounter, which means no intervention, especially no stabilizing intervention, has happened. Let's have a look how this goes.
So one of the things that we know is that sometimes people who have difficulty with anxiety and things like that have also had some bad experiences in their lives.
All right. So some words will have been exchanged already. That would probably not be the first thing that you say to anyone, but let's assume that they did the necessary framework of their interaction. Some psychoeducation. It's not that bad. When I heard that the first time, I was thinking like, well, all right, okay. We know that this and this might be connected. Okay, providing some knowledge. And now, in my opinion, it goes downhill from here, because now she's basically diving right into the negative stuff. So let's see.
So I'm going to ask you some questions about some of your difficult experiences that you may have had. And I'm just gonna ask sort of yes or no questions. I only need sort of headlines. I don't need a lot of detail about the things that happened right now, but I'm just.
So these are good ideas. The idea to say, just answer briefly, just yes or no. I don't need any details. These are sentences that you can have in your repertoire, but not at this point in the conversation. This is a cardinal mistake, in my opinion, to start off such a history taking with, yeah, tell me about the trauma. Like, what has all happened to you? Put it on the table. This is, in my opinion, absolutely opposite to everything what trauma informed stands for. Avoiding to being overwhelmed with the negative stuff is not being accomplished by basically opening with that, starting with that, before giving the client tools to manage emotions or flashbacks or whatever all might come up when talking about that. So without providing any tools and then diving into the negative stuff. It's just improper, and it's a big, hard no on that approach in any context.
Just going to ask you those questions, and if anything about this interview starts to make you uncomfortable.
Yeah, something is starting to make me uncomfortable already. and that is that she even goes there at that moment in time.
You can take a break. If I ask a question you don't want to answer, you can.
And that's the tricky thing for people, I think, to identify, because if you look at the comments under the video, there are a lot of good comments, like, oh, she did so great, and oh yeah, it's so informative, it's so interesting that I learn all this. And again, we're not here dissecting specifics of her wording or phrasing, if that is optimal or not. This is really a big red flag. It's a good example of what not to do, like not even going in that direction. No matter how nice she is now trying to defuse the bomb that she just put there, it's impossible. You just don't go down that road. Even if she now uses sentences which seem so trauma informed, people seem to react to this like, yeah, but isn't she doing that very nice? The way she's very gentle. But you'll see where this goes.
Just say pass, and I'll just move on. So it's really up to you what you share, but I do want to ask you these questions. Is that
So it's up to you what you share, but I do want to ask you these questions. Okay, don't even go in that direction. How about that?
okay?
Yeah.
Okay. So,
Now, what's she supposed to say, right? Like, I mean, she's an actor. At least this was the description of the video. So it's role plays. So very grateful to have examples that we can talk about. I mean, that's really good. But what's she supposed to say? She doesn't know what she's getting into. She's there with a professional. She trusts that what she's being exposed to is the responsible way to do. And in my opinion, it is absolutely not.
have you ever been physically hurt by anyone? Either as a child or an adult? Hit?
Yeah, I had a boyfriend a couple years ago, and he would hit me sometimes. But we're not together anymore, so.
So now there are a lot of things that we could pick up from her reaction to the question, and we could, have an interesting conversation about these things that are happening that we observe, signals that she gives, nonverbal cues. But that's beside the point. We shouldn't be here. We just shouldn't have that kind of conversation. That is so important to me, that we have a negative example of what not to do. You might do that after stabilization, when you want to complete the important aspects of the biography and complete your anamnesis. Sure, it's then appropriate, but really not as an intake conversation.
Was there other kinds of physical abuse? Did he do more than hit you? Was there anything?
So now she's digging. I mean, if you make that mistake to even go there, then at least don't dig. If your client presents the topic very early on in the conversation, if you just open the session and what would you like to talk about? Why are you here? If you openly, and then somebody puts it right in front of you on the table and says, yeah, I was hit by my ex-partner, and now I have trouble sleeping, or I'm very anxious in, meeting new people. Okay, then it's on the table, right? Then you would acknowledge that, okay, I understand. Let's not go into too many details of that right now. We will get to that later. First, I would like to show you some techniques so that you can actually feel better, that you can feel safe. Is that all right? Yeah? So you would steer away and redirect the attention to something stabilizing.
No, he would just slap me sometimes. Usually when he was, if he'd had a really hard day at work.
So here the disconnect between the emotions that she expresses or does not express with what actually happened. So actually a pretty severe experience. In general, people would perceive that as a severe life event, being hit by your intimate partner, especially when it's regular. So there seems to be a distancing that she's doing, which is protecting her. You wouldn't disturb that for now. Again, you shouldn't be here at that point in the conversation at all. But since we're seeing it, I can as well comment.
And maybe he would be drinking or something. He would slap me when he got home, but I got out of that, so that's good.
Okay, she got out of that. This is definitely a moment. If that were in any other situation, then I would say, of course, you would reinforce that that takes courage to get out of, and it's difficult to get out of destructive relationships like that. Absolutely.
It's good that you recognize that that was really not acceptable behavior,
Yeah.
and that you didn't want that in your relationship. And it's great that you were able to get away from that.
I think she's trying the right thing here, but she's using a bit too many words. Is too much framing it, interpreting it, and you can keep it very short and say, very good you got out of that. Yeah? Very good you got out of that. Just affirm this. Done. Next thing. What are the best words or optimal words to use in such a situation? And, you can come up with some very refined ideas. And I think that's worth it to really think carefully about this, to have a good sentence ready in such situations. Like, very good you got out of that. Is maybe very compact and does it all. There is a you. To get out of it is kind of summarizing whatever steps might have been involved. Life is complex, but in the end, also a sentence like, good that this is over. But here, the active part is lacking, because she left, I think. This is sometimes important. Where was the agency? Where was the client active in that decision, right? She left. She said no, or even she didn't say no, she left, and that basically expressed the no to the relationship. So keep that very short here, I would say. It's not the moment to dissect surgically now what happened in this whole phase.
That's really good self-care that you were able to make that decision and make a different choice and create more
Yeah, too many words, right? She's talking more than the client.
safety for yourself. That's really good.
Thanks.
Too early.
What about sexually? Has anybody ever?
Yeah, and that was a moment I kind of ruined that for you now, because I was like, let me go back a little. I mean, I'm sorry, I don't want to sound cynical, but ruin the transition. Let's go through that again, me talking less.
Great that you were able to get away from that. That's really good self-care that you were able to make that decision and make a different choice and create more safety for yourself. That's really good.
Thanks.
What about sexually? Has anybody ever, when you were a child or as an adult, touched you against your will? Anything like that?
Okay. I cannot really tap into my reaction to that right now, because it was really a visceral reaction. It's like, how can you do this? Yeah, I have no words for how misinformed and misguided it is to do something like that to people. I'm not saying everybody is then re-traumatized if you ask these questions. I'm just saying it leads nowhere. You get some information, you put that then in your notebook, and then what? It's going to come up anyways in the appropriate moment, but please after stabilization. And this digging and really trying to find out if there was anyone, it's really the worst you can do.
Yeah.
Now we can use this as a teachable moment. Well, teachable in other ways than what I just said. Look at her reaction, a delayed response, the lack of words, maybe even the searching for words. All signals, okay, there is basically a traumatic experience lurking, which you just inquired about.
I don't really want to talk about it though, but Yeah,
Okay.
when I was little.
How little?
Okay, she says she doesn't want to talk about it. That is a very, very strong signal that always requires a lot of attention and has a lot of weight. And to change someone's opinion about this, if they want to talk about something or not, will usually be a result of stabilizing work. Stabilize more, and then maybe she says that she cannot talk about it. But again, talk about it is anyway something that you don't need to do. You either stabilize or you help somebody work through it with the appropriate processing techniques. There is no talking about the trauma. For what reason? Let's talk about it. Then the other person knows. What's that? There is no justified indication for talking about trauma almost ever. Because what's your justification here? Like, what's your reason to need that information? So just that you know? I mean, come on, yeah?
Just vaguely.
Like 10, I
okay.
think.
Okay. And was it a family member or a stranger or?
It was a family member, but I don't really like talking about it.
Okay.
So.
You don't have to. Okay. Great. Thank you for telling me that much. That's really all I need for right now.
Yeah, I really don't know what to say. Great. Thank you. This is really all I need right now. Really, you really needed that. Okay, I disagree.
Although it may be important for you to talk about that later at some point.
Yeah. Again, hard no.
You can wait until you're ready.
Okay.
The point is here, when people only have the tool to talk about stuff, then these things happen. You know, if you have no tools and it's all just talk, well, then at some point you want to talk about the trauma. And then you're maybe the better therapist if you talk about stuff early. And you're maybe so proud of yourself that you're not afraid to ask the difficult questions. But that is not the situation. This is not a conversation with a psychiatrist who is inquiring about suicidality, for example, who has to ask pretty straight out, have you considered ending your life? Have you made plans? And if that all is being answered with a yes, then when was that? Have you tried it? Then you have to ask these pretty straightforward questions, because there is no other way, because the information has real consequences for a psychiatrist, right? If a psychiatrist has to evaluate the suicide risk of a person, there is no way around the direct questions, okay? Very, very different from taking a history of past traumatic experiences. That is not something that you have to evaluate in an intake conversation. That should happen at some point, but after stabilization.
Okay. As a child, sometimes parents aren't very available, don't provide basic food, clothing, shelter, that kind of thing. Did you ever have that experience of being neglected?
I mean, great acting, how she shows basically where these questions put her. Big compliment for that role she's getting into here. And that is not nice to even simulate such a role. Needs some good self-stabilization afterwards to shake this off, what you were basically empathizing in simulating there. So the simulation work is intense. So compliments for that. And We can learn some things from her body language, the obvious things, the way she's biting her lip, she's getting out of the eye contact. A lot of negative emotions obviously associated with that.
What's going on, Trisha?
Yeah, the total lack of stabilizing interventions is painful to watch.
I don't like all these questions.
Yeah, starting to get uncomfortable, huh?
Yeah, better believe it. Started getting uncomfortable a while ago.
You feel that somewhere in your body? You're feeling that in your body?
Yeah, the reinforcement of basically now inquiring precisely what is the emotion, what does it cause it, where is it in the body? Come on, without her having any tools. Yeah, let's not forget, this client or patient has zero tools right now. Also, the therapist does not know what all else is just right behind the corner. And she basically encourages a dialogue about those very traumatic or traumatizing moments of extreme helplessness associated with pain. Worst you can do.
Yeah. Sometimes these questions can bring up very difficult things. I know. Sorry.
It's not funny, eh? It's really not funny, but the way she says sorry here, I don't know. It's like, what is this? What am I watching? Seriously, right? And one of the issues here is that people look at this and they think that's the way to do it. That is a problem.
When you're feeling like this, what helps you?
Light at the end of the tunnel, asking for a resource. Couldn't she have started the conversation like this? Like, okay, before we talk about, all the things, what are things that you do when certain feelings come up? What do you do for yourself? Not the optimal way to start, but it's certainly a way.
My cat.
Tell me about your cat.
Very nice.
She's a jerk.
She's a jerk?
That is actually funny, but no surprise.
She's not very friendly.
Most cats are.
She's friendly to me though. When I'm really upset, she'll like cuddle with me on the bed and stuff.
Right. If she would say, well, she's a jerk, well, this is a little bit confusing information. Of course, cats are how cats are. They are often, So one could react with, yeah, but what do you like about her? Right? To always steer back to, because there got to be something positive. And then she would immediately have said, yeah, but she's friendly with me. And then she would continue with what she's saying right now.
So she knows when I'm really upset, but
It's great that she knows.
yeah.
That's pretty amazing.
She's just kind of a jerk.
Yeah, it's not just amazing. Maybe ask, how does she show that? What does she do? And then she would probably say something like, well, when I'm upset, then, she comes and she sits on my lap or she purrs. And then you get her basically talking about these soothing moments. Get the client talk about the soothing moments. What are strategies to soothe? What do you do for self-soothing? What is the stuff that already works? Okay? Strong focus on the things that are okay.
She'll bite and scratch at whoever she wants to, and she wants to be snuggled until she doesn't want to be snuggled. So
What's her name?
Persephone.
Yeah, that's very good. Give the cat a name. Very important. Good idea. Different body position. She seems much more open now. She's conversational. She seems a little lighter. Just talking about the cat changed her whole, and that's what your job is in the beginning of the whole process.
Persephone. That's a great name for a cat.
She came with it, and I decided to just leave it.
Wow. I like it a lot. Great.
Yeah. Now 5 times the cat's name is so great. Well, it's nice to know the cat's name so that in later work you can refer to it. You can say your cat, that's fine, or you say the name of the cat, wonderful. But emphasize more the what does the cat do and how does that make you feel? Those would be the questions. And sometimes when I do seminars, I get this feedback, Matthias, it seems all so simple, but the way to get to the point so quickly, that is still an art. And that's exactly it. So when you're upset, what do you do to make you feel better? Well, I have a cat. Interesting. Tell me about it. Yeah, whenever I'm, upset, and then, my cat comes, and she's, she doesn't like strangers, but she's very nice with me. So what happens when you're upset? What does your cat do? Well, she comes, she sits on my lap, she notices. How does it make you feel? Yeah, well, and I feel not so alone. It's just nice. Somebody notices. Very good. Done. And then you have something, right? And then you can start resource work from that. Can you, from these many examples that your cat was there for you and noticed it when you were upset, can you recall maybe one specific example? Where does it usually happen? Well, in my living room, when I sit on the couch. Well, someplace in the house probably, right? Right. What is the image there? What do you see? Well, there's my living room and this and this and this. And then your cat comes. Where is she? Is she next to you? Is she sitting on your lap? And you construct an emotional resource from the image through all the senses. And you go further. How does it feel? Do you feel her fur? That she's soft? Do you feel her paws, her weight on your lap? Of course, these are just suggestions, and you have to get the actual information without suggesting too many details. I'm just trying to get some details now so that you can imagine how to fill up all the sensory modalities. So there would be touch, there is the physical, not just the feeling and the sensation of that, but there's also maybe the weight of the cat, the warmth of the cat. She feels warm when she's sitting on your lap. And maybe a smell even, the sound she makes, the purring. And then how does that make you feel? It calms me down. It's nice. Very good. Where do you feel that in the body? Oh, maybe in my chest. Very good. Just allow this feeling for a moment. And you basically have her already in resource work. This is how to start the conversation. Ask about the things that she's doing, and from there construct an emotional resource instantly. So that later in the conversation, when you need something to get her out of something negative that just came up, that you have something. It's already one checkbox is then already checked. Takes 3 minutes or 4 or 5, very short period of time, and you have already given her something. Then you can say, well, even if you're not at home, your cat is not around, you can get into this feeling. Just imagine your cat being on your lap. And then you let her close her eyes if she wants to, and then you can let her imagine this and re-experience this. You already installed a tool for her, okay? Something that she can do when she is with other people, somewhere outside, wherever, to tap into that feeling of safety or whatever the feeling is that she has in that situation. Good job, right?
It's wonderful to have a cat named Persephone who's good at helping you when your feelings are difficult. That's really good. That's you know.
Yeah, not even as an actor, she feels what that person is saying to her. Yeah, it doesn't reach her because it's just talk. Let her feel it. Let her feel it. That is a tool.
That's a blessing there. Can we go on with the interview now?
Yeah, I guess.
Feel okay
Yeah.
about continuing? Okay. I'm going to ask you some different questions. I want to ask you a little bit about your living situation. So, what kind of housing do you live in?
I have an apartment.
Mm-hmm. And how long have you lived there?
Almost a year.
So not that long. And
No.
who do you live with?
Just the cat.
Just Persephone. Okay. Do you feel safe where you live?
Safer than when I was homeless.
Mm-hmm. Safer, but maybe not entirely safe?
Yeah.
Yeah. What makes you not feel that safe where you live?
Yeah, and here we go again. Well, don't get me wrong, this is important information about a person, the matter, and I know I keep repeating myself, but, obviously people seem to still get this wrong, is the timing of it, right? It's important to know what the living condition is and what are sources of insecurity. Are there people around who are maybe even past perpetrators and all these kind of things. The information is important, but it's just not the moment. Well, the living condition, this may be something you ask in an intake conversation, but I would be careful in how deep I dig.
Kind of have a landlord.
So here, these long pauses usually signal that something bad is coming, meaning steer either through it, that you just signal that you're satisfied with really just the general information, and help the person get through this quickly. Maybe get the information that you need, but okay, let's move on. Yeah, this let's move on attitude is important. Okay, we looked at it. That is bad. Okay, let's move on. And help with that. Like, okay, let's move on. Next question. Yeah, not giving it too much space and weight. It is right now not the moment to work on it anyways.
Landlord situation.
Difficult relationship with your landlord?
You could say that.
Can you tell me about it?
Yeah. What to say, right? Yeah. These moments never end well. Okay? Nobody ever came with a happy story after such a pause, meaning you know already, okay, there's an issue. Take note of that and then steer clear. Stabilize. Why do you need to know the details now? There's obviously something ugly going on, right? That's enough. I mean, you shouldn't even be in that situation, but if you're in it, at least I want to, help you and sensitize you to then getting out as quickly as possible and not poking more and more and more in the same spot.
I don't make a lot of money, and my hours got cut at work recently. And he said he was going to evict me. And I really didn't want to be homeless again. So
Yeah, that's typical. Heavy breath, you know, fiddling with the clothes. It's uncomfortable, and that is an understatement.
he said if I had sex with him that I wouldn't have to pay my rent.
Wow. That's really hard.
No, lady, this is not hard. This is disgusting what this guy is doing. That is the comment that it maybe merits. Here it came to a point when I watched this. I watched Until Roundabout here the first time I watched it. The first time being the only time before this time that I watched this. Where I wasn't sure, is this for real? Like, seriously, are these guys for real here? Is that hidden camera? Is that like I triple checked, are they trying to show bad examples? Like, you know what not to do? Because that would be legit, but then please declare it as such.
It makes sense.
Yeah, makes sense. Now, what does make sense? Does it make sense that the landlord is extorting her in that way? Or does it make sense that she feels the way she feels right now? Like, seriously, can you make it any worse? I have no ideas how to make it worse than where this conversation is right now.
So you agreed to that?
Well, I didn't want to be homeless again.
That's right.
Well, she found a way to make it worse, so you agreed to that. Like, you agreed, like, okay, so you decided to do that then? What the blank? Seriously.
And in order to survive, anyone is going to do what they have to do, right?
Oh, spare me the speeches.
But it sounds like.
That's what I keep telling myself.
Mm-hmm. But it's also upsetting you a lot.
Okay, Dr. Laurie Markoff. Yeah, you figured out why people get broken and how people are broken, and you know with a few questions how to get to the pain point. That is not a skill that serves anything. This is simple. It is cynical in itself to talk to people like that. It's not okay, and I really challenge this approach.
I just keep thinking, like, what if somebody finds out? And now I told you, so obviously people are going to find out.
Well, what do you mean, people?
So she raises an issue of confidentiality here very clearly. Like, from here on out, I have not watched it yet, so I'll be surprised as you will. She raises, okay, I told you, no, people will find out. Immediate reaction would be to say, well, everything you say to me is obviously absolutely confidential. Yeah, that's it. And then you back that up with your respective professional, mentioning your professional framework. If you're a psychologist, if you're a doctor or whatever you are, that you say, this is part of our profession. That remains confidential, right? You have to reestablish safety.
Well, I mean, don't you have to tell people when stuff like that happens?
No, actually, what you and I discuss is between us, um, and you'll get to decide what you want to do about that situation. So we can talk about it, but you get to decide.
Yeah, it's not actually symmetrical. It is not what you and I discuss as confidential. It is what the client says is confidential. Obviously, the client is free to speak about her experience or what the advice was that the therapist gave to her to someone else, as far as I know. I mean, I'm not a lawyer, but this is how usually confidentiality works in the medical context. It is not a two-way, it's not a symmetric thing. You know, the care provider, the licensed professional, is supposed to maintain confidentiality with very, very few exceptions, which depend on the legal framework where you're operating, so you have to check on that. But the other way around, there's openness.
I only have to disclose if you're going to kill yourself or someone else, to somebody else. Those are, or if you're abusing an elder, those are the circumstances under which I have to let other people know. So this is something that's just for you and I to talk about.
All right.
And as
Fair
part
enough.
of, our work together, we can decide what's the best way to take care of yourself going forward. So it's entirely up to you what we do from here. And I totally appreciate the courage it took to let me know that was happening. And
Openness for decisions, and that the client is making the decisions, is one pillar of trauma-informed care, and that's important. However, there can and should be guidance and the expression of a recommendation sometimes from you as professional mental health care providers. And of course, you would always phrase that gently, for example, in a way that many of my clients, it helps to doing this and this. Or often it can be a good idea to do this and this. It's maybe something you can consider, right? So have something. Just to stand there and say, well, now this is all up to you, I think is too much of too little. Of course, you're not going to be directive and say you have to and you should. But that's the other extreme. If I imagine I'm in the situation and, well, I'm here that you also provide me some guidance, right? Okay, I can decide. Great. But so many things feel strange, or very often in my life, I think sometimes something is the right thing for me, and it turns out to traumatize me. So can I really trust my own judgment? This is a very fundamental part of trauma, is also people say yes to a lot of things which turn out to be very bad for us. So just to say I can decide it all, well, yeah, of course I can and I should, but give me some information, some more clues I can base my decision on. Here comes the point of psychoeducation. So you would share some information like, well, usually this and this is a good idea. For many people that works. Not for everyone, but for many this works. For others that works. You can try this out and then decide. So create a basis of information on which to decide. Just sitting on two chairs and say, okay, now you decide where we go from here, is, I think, too much openness. Like, okay, now what are my options? Like, and I'm not opposing to maybe have it very, very open and say, what do you think you need right now? Okay. But then once the person signals that they don't know, that they might be helpless, like, I don't know. I've tried so many things. I spoke to so many people. I tried this, I tried that, nothing works. Well, then provide something. Okay. But I'm rushing ahead here. Maybe she's doing that in the conversation that follows.
I'm happy to be with you as you sort out what's really the best path for you going forward for your own well-being. We'll work on that together. Does that make sense to you?
Kind of.
I
No
also,
one, no one's ever said it to me like that before, so I thought you had to tell people. But
no,
if not, that
no.
All right, and this is the whole tragedy, She thought she has to tell the practitioners this and this and this happened. Unfortunately, it is very, very typical that what she expresses here, that could be very real.
And I should tell you that, remember how I said earlier in the interview that people who've had adverse experiences like sexual abuse in their past or physical abuse in their past, that sometimes that's connected to what happens going forward?
Yeah.
Well, it's not, it's really common for girls who've experienced sexual abuse later in life to end up using or being in a position where they end up using that for survival purposes. So what you're experiencing is actually probably a lot more common than you think.
I mean, she is, factually right in making that connection. This is a very low-hanging fruit because it's very simple to know these things. Now, psychoeducation important? Maybe not yet. Well, anyways, that conversation, in my opinion, is so messed up that any comment I make now is based on the premise that we accept what happened before. You shouldn't be in that situation. And I also think it could be a bit too much information right now, giving her basically no tools, making this grandiose promise of we're going to work on that. Like, how? You haven't shown anything that is working on it.
But just like you didn't want to talk
exactly.
about it, the reason you don't know that other people are doing that is because they don't often talk about it. So that way you think you're the only one in the world who ever ended up in this position, and but in reality, lots of girls who've experienced sexual abuse grow up, and it changes, something that then.
Yeah. And this is the point of, okay, I'm not alone with this. Yeah, great, but still I have the problem. Now, how do I get out? It is overglorified the effects of I'm not the only one with this. That can sometimes be important, but it also doesn't solve the problem. Okay, you're not alone with this. Okay, it's something that happens to people. Okay, but now what? It's a minor detail that is being overemphasized, where instead some actual techniques that help her go towards a solution should be applied, rather than exploring too much of how the things all work. And so many people have understood trauma quite well, how it works, how stuff is connected, what leads to the other. But very few actually successfully implement solutions with people. You'd be surprised how few people, even among the professional community, the care providers and the licensed people, how few of them actually provide solutions.
They end up putting themselves, they end up in situations. Now, obviously, you didn't create this situation, right? Your landlord is the one who is proposing to use his position of power to get you to do something that isn't what you want.
Yeah, and this psychoeducation, that sounds like from a psychotraumatology textbook. Okay, there is the power dynamic and all this and this. I mean, it's okay to speak these things out, but I don't think that this is the key part of the intervention that this person right now needs.
Want to do, and you're not responsible for his doing that. You're not. You're just doing what you've learned to do to help you survive. And we can work together for you to figure out what other options you have and what else you can do.
Okay.
Does that make sense?
Yeah.
Good. Thanks. Thanks for being so open. So are you ready to continue with the rest of the interview?
Yeah.
Yeah, you're doing a really good job. A really good job. A lot of hard stuff, and you're letting me in, and that'll help us to be able to, figure out together what you need to do.
That causality of, okay, you tell me, and then I can help you better. Let's think about that for a moment. Like, if you want to know some values in your blood, right? You want to do some blood work. You have to take some blood. There's not really a way around that. But the big question is, do you really need blood work in order to help the patient in that moment? This transaction happening here of you tell me what has happened to you, and then I can make a plan and a strategy with you. It doesn't hold up, and it is not necessary to know these things to get started working, especially stabilizing. At a later point, yes, you might have to know some of the things that the person wants to work through, but it's not true. It is just simply not true that you have to know somebody was sexually traumatized or not, or other aspects that she was inquiring about in order to get emotional work started. And it is improper, and it is very pervasive and very persistent out there that that's the deal, basically. The other person has to know, else they cannot help you with it. That might be different in somatic medicine, right? If you don't tell the symptom, well, how's the doctor going to know, right? If you don't say you have a fever, or you don't want the blood work to be done, or there is no information, how can an assessment be done? But when it comes to an emotional process, things work a bit differently.
To, help with your anxiety and to make your life work better for you.
Okay.
Okay. So now I'm going to ask you some questions about your... So we've come to the end of all the questions, and thanks for hanging in with me. I know it was a lot of questions, but I feel like, I've gotten to know you a lot by asking these questions. So actually, you've done a really good job of helping me to sort of begin to piece together.
Yeah, this is exactly the question. Who's helping whom right now? Yes, of course, you need some information from people, but really it's much less than you think, especially in the very beginning. And where is the doctor helping the client? Where's the tools? Where's that? I mean, it was maybe in that relationship building, people are seeing that there is something constructive. And I agree that's important, but this is just not enough. Like the client's expectations should be higher. I mean, you should expect to get more out of this than just, you put the bad stuff on the table, and then you get like a pat on the back, and oh, well done. This, I'm sure this was very difficult for you, and thank you that you trust me so much to share this stuff with me. Come on, really. Where is the stabilization? I don't see it.
The puzzle of what we're going to work on together. So that's really good.
Yeah, the puzzle. This is not an academic exercise here. Help her going through an emotional process, and it has to start with positive emotions, else you have nothing to counterbalance the negative stuff. Very simple principle. It's not a puzzle like figuring it out. It's a trap. You're not getting the job done, especially not with someone who is traumatized, probably in a complex way. Look at all the trauma here, and only half of it is really on the table. There's going to be a lot more and a lot more details. So seriously, you're going to puzzle that all together and think that that's going to do something? I don't think so.
So now that the interview is over, the next step will be we'll make an appointment before you go, for you to come back. But I just want to ask you now, how are you doing? How are you feeling?
Well, I'm not shaking anymore, so that's good.
Yeah, I mean, if that were real, I'm like, what an incredible resilience this patient has, that she even got through that and is shaking less now than before. Quite incredible.
I think I'll be okay.
All right.
Um,
So if
Yeah.
after this interview, you go about your life and you start to have difficult feelings, what are some things that you already know that you can do to help yourself with those feelings?
Well, I play the guitar, so I think sometimes that helps a little bit, and
That should happen much, much earlier. Resource-based work means you flip the stuff around. First the resources and then the bad stuff comes after. Now let's see. So the playing the guitar, very nice. That can be built out into an emotional resource in a proper one.
And then there's Persephone.
the mean cat, yeah.
Yes.
Yeah.
And is there anyone in your life that you could call if you were having a hard time?
Yeah, actually my best friend, she knows about all my anxiety.
Why do we learn about that before the meeting ends, Do that early. Yes, who are, the constructive, helpful people in her life. Very important to know. What about parents, actually? Where are they?
And everything. So sometimes I'll call her and just say, hey, I really need to not, be here or whatever. And she lets me come over. So
That's great. So you have some ways to take care of yourself. I just want to make sure that
Yeah.
the stuff we opened up in this interview.
Yeah, exactly. Exactly. The stuff she opened up. Congratulations. Now she's making sure that she's not decompensating after leaving the session.
Doesn't end up interfering too much in your regular life. So thanks very much, Trisha, and I'll see you next week.
thank you.
Take care.